Hi, I'm Dr. Pannozzo. Thanks for watching our program. The patients you're going to see are regular patients from my practice. Whatever they say on camera is how they feel and what they want you to know. So enjoy the program, and if you have any questions, write in and we'll answer them. Thank you. And your trouble is lower back.
Yes. Oh, did I forget one completely?
No. Which side's worse? Right?
Right side, yeah.
And right leg bother you?
Yep, sometimes goes down my leg, sometimes even comes into my calf.
Okay, which part up here?
Which part up here? There's nothing now. I'm fine with my leg right now.
Okay,
Right now it just goes here. I don't know why.
But it did before?
Yeah.
Then it wasn't on the side?
This problem has been going on for years, 2 to 3 years. And so it changes, and it now seems so complicated to me because it's changed so much. I do have bad scoliosis. I have a big hump on one side of my back. And I don't know if that's a muscle that's developed just to keep me erect.
No.
Or if it's the bone.
It's actually bone turned.
Okay. So
we'll turn that over.
Okay. So it started a couple years ago. I ran a half marathon, and the pain was so bad at about mile 11, and it was all the way down my leg. And it stayed with me for a long time. I had trouble walking. I got through it. I stopped exercising and went to a chiropractor. It began to heal for a period of time. It comes back. I learned things that I shouldn't do that aggravate my back. So if I start to feel stiffness, I don't do anything with impact, and I try to back off the weights. But what I have noticed is it's no longer healing, and it's changing. It's getting worse. It used to always be lower back and down my leg, but all of a sudden, this started about a year ago, I get this, like in this hump area, it seizes up on me, and when it happens, I can't move at all. The first time it happened, I was sitting at my sister's house having dinner, and I could not stand up. The only way I could get off the table, I had to get down on the floor and kind of crawl into the house. And it didn't happen again for a very long period of time. I went in the house, I laid down, I put ice on it, I drank a ton of water, and it went away. If I lay down for 40 minutes to an hour, it goes away. It started happening, this thing, more often. This is why I'm here. It has started happening weekly. Not that bad, though. Not as severe as that. But I feel it. As soon as I feel it in that area, I know what it is, and I will have a tendency to go lay down. But it happens. I can be standing up, and I can't stand and talk to somebody too long, or I can be sitting, and sitting too long hurts too. Like, it feels like everything hurts now.
What kind of treatment did you get?
None. I've been to the chiropractor. I tried acupuncture. That's all I've done.
Are you still getting your manipulation?
Yes.
Chiropractor?
And the last time I got manipulated was last Thursday, and I was in pain all night.
Yeah,
like
why
this,
do you do
this
that?
came back
Yeah, I know, but why
severely that night because I originally thought it was helping me heal. That was the first time I ever had a negative reaction to chiropractic. And the reason I go is because he convinced me, because I'm off kilter, that, that helps maybe keep me in alignment and help me heal. It's not helping.
I see. Did you see anybody else about this?
No. I've never been to a real doctor because I don't want surgery and I don't want drugs.
Come to the right place.
I thought that I could heal it. I thought somebody could tell me what to do and what not to do and I could heal, but it's not healing.
Does this wake you up at night?
When it feels severely injured, the answer would be yes. Right now, no. I have gone through periods where I couldn't lay on either side, that it would cause me great pain. My hips, like I said, it changes. I don't know why. And I did have an MRI. That's one more thing I didn't tell you. I had an MRI a year and a half ago, and I have 5 bulging discs, is what they told me. So S1, 2 S's and 3 L's. I think that's what it was. Why are you laughing?
Who sent you to get it?
Who sent me to get it? I called around. I didn't have any health insurance and I couldn't really afford an MRI. So I just called around to everybody I knew and I found a friend who was a PA who got me one at a cheaper price at Radiology Regional. So nobody really referred me.
It's PAs. Okay.
And she didn't refer me either. She just asked them for a favor to reduce the price, which was nice. So that's how I got it done.
Yeah, because she's involved with the office that refers there, but still, a PA should not get involved with you. Slide down.
She didn't.
Okay. All right, we're gonna examine you right now. She's a Florida person, you could tell.
How's that? Barefoot, flip-flops, right?
Yeah. Oh. Okay. We're glad you came because we have a special way of looking at this. Our film we do is a patented product, and it's my patent.
You mean it's an X-ray? Is that what you mean?
Yeah, it's an X-ray. No one else in the world could do it.
Really?
Yeah, it's mine.
You invented it.
Yeah,
That's pretty cool.
it is pretty cool and it's accurate. Okay, stand down.
So you mean you don't need an MRI? An X-ray works?
MRIs are not going to tell you where your problem is on your scoliosis.
Oh.
Hold this up. Yeah, it's got to be right here. This bone is turned, so we'll turn that bone this way, and that'll take that pain out permanently. Well, you're not done.
You're gonna fix me?
Yeah,
You're gonna turn the bone?
of course.
Stop it!
What do you think? Okay, go ahead and bend forward now. I'm trying to look and see where's. What
Then
bothers you?
you'll really
you
see
think?
it.
What bothers you? Anything?
When I bend forward,
Yeah, right here. No?
you know, that actually feels
Okay,
good.
come back up. Back towards me now.
I mean, but I'm in pain all the time,
What
so
bothers
I'm
you
so
now?
used to
What
it.
bothers you now?
Here,
I'm trying to produce the pain.
I'm sorry.
Which side?
It always hurts.
Which side is it on?
It's kind of in the middle right
No,
now.
no, going backwards. Which side?
I feel it here
Okay.
and here.
Okay.
This always hurts, so this
Okay,
is sore
go
right now.
left, Then left.
And yeah, I definitely feel.
Yeah, then right.
And then right here.
You're not helping me.
I'm having a hard time. I can't feel it anymore. I'm so used to it. And I apologize. It hurts everywhere.
But you know something?
What?
You don't have to help me.
Okay.
If I don't get it, it's because I don't know what I'm talking about.
It's everything in here is so
Oh,
sensitive.
you're going to be good. Let's go take your picture. The basic reason you have a scoliosis is you have a short leg, right side.
You mean the short leg came first?
Yeah, definitely. Your whole pelvis is tipped this way. And that gives you an abnormal weight bearing, which gives you injury,
Okay.
ligaments. So you can see that this is down, right? This is your hip, this is your other hip.
Oh, this is my belt, right?
Yeah.
Okay, it's like, what the heck? Is
It's
that
not
inside of me?
Not something you ate.
Good. Okay.
Now this is tipped down, you can see that. All this is supposed to be straight.
Okay.
And so your biggest problem you have, L5S1, you're not symptomatic. This is where you're symptomatic. That side of the leg and the calf, it's coming from here.
Okay. Is that the bulging disc right there?
We don't talk about bulging discs.
You
It doesn't
don't?
mean anything.
Oh, okay.
They're ligament sprains is what they are. You got to simplify things. They maximize things for surgery. That's a thing that goes on with those people.
Okay.
We don't do that. We tell you what's actually the truth.
Okay.
4, 3, 2. So This is the beginning of your curve, and that's the end of your curve. So we can hit that and straighten it up. It's just ligament holding it. It's just scar tissue.
Are you kidding me?
But I kid you.
Like, I don't even know if you can fix me out. I can't. Nobody. It's impossible. Everybody thinks it's impossible.
It's not.
It is not. You have to know how.
I'm gonna cry. That's like.
That's all right. Go ahead.
Okay.
But you have to fix my
me.
website.
Okay, you got a deal. I'll trade you.
Isn't she gorgeous? She comes from.
You're so
Where are you
sweet.
from?
Fort Myers.
Fort Myers, the other side of the state.
Yes.
Okay, so
My daughter is beginning to get the same curve as I have. She's getting a hump in her back. She's 15.
they're all injuries, so get her in here because if you take her anywhere else, they want to operate her with the rods and everything. You don't want that.
Okay.
You don't need it.
Okay.
These guys are just crazy. Don't go there. They don't really know what they're doing. I mean, you know, it's. I just explained the whole thing to you. Give me that. It's the right heel.
Okay.
What are you wearing? Say it. You
Sandals.
don't even have shoes on.
Flip flops
No.
now.
He'll tape it in.
I'm always in flip flops.
That on there.
So
Take a
you're saying that my right leg was always shorter, and that caused the scoliosis?
Yeah. I think you got it right.
You think I have it right?
Yeah.
This is right.
What you're saying.
Okay. I do like simplicity. I'm all over that.
You bet. Me too.
Okay. So this I permanently wear.
We go for the shots? Of course you did, because you didn't travel here for nothing.
I didn't travel here for nothing.
That's
So
right.
tell me what you're gonna do.
We're going the back row.
All right.
Yeah, I'll show it to you.
You have to ask.
Well, I mean, I'm trying to
It's right
remember.
here. This was the, she's got, this is a large area. It's like 2 or 3 vertebrae.
Yeah.
But this was the main one on film. And that's the one that was shot. And it's half of what it was.
Absolutely.
I didn't bring my computer. If I stay, I didn't bring anything to work.
See this bone formation here?
Yes.
This is what was keeping that curve. If you don't get rid of that, then this bone won't turn. That's scar tissue.
Which vertebrae are those?
So 5, 4, 3, 2, 2, 3 left. And come on. Changed already.
Holy crap! Can you go back and forth quickly?
So it did change, and we know it. Your hump is down, which means this bone here turned already.
I can feel it.
You can feel it.
I can.
Then the bottom one was stuck here, and then it opened already.
Can you show me that again? Where is it stuck?
And now it's open. That just happened in a few minutes. So here was 1240, and here it's 1243, and that change already took place. So that'll continue on.
What'd you do?
They shot it.
Shot of what? Into what?
Into a ligament. That's a ligament holding. These are all ligaments. All ligaments.
They're
That's all they
ligaments.
are. Yeah.
So you put a shot?
When they talk about a herniated disc, they're really talking about a ligament.
Well, they are.
Yeah, they maximize it. That's not right.
So you inject what into the ligament, and then what happens?
It softens and scar tissue, so
Becomes-
it softens and lets the turn take place.
And the turn takes place naturally because the spine knows where it wants to be?
Yes. The way it's engineered, this is an abnormal situation for the body. It can't help, it can't do anything about this because it's scar tissue. So once you relieve the scar tissue, the forces will push the bones straight. That's what's happening right now to this.
So that'll keep happening because that injection
Yes,
is in there and it's
that's right.
relaxing?
And you haven't seen the end of it yet. It continues on.
Really?
That's why we have to see you a couple of days, because we can't do everything in one day. We've got to wait for the turn to take place.
How many times do you feel like you need to see me?
Well, it'll probably be 5. Who knows? 5, 6 times. But I do what I could do in one visit. You know, you're here for scoliosis, right?
Yes,
And how old are you?
I am 43.
And you've had this how long?
I've had this. My pediatrician detected it when I was probably about 12,
Uh-huh.
13. Sent me to an orthopedic surgeon down at Jackson Memorial. My curve was measured approximately 13 degrees, I would say. And they said, you know, sit back, wait, let's see what happens. I was short.
There you go.
I was maybe 4'6", tiny little ninth grader. Came back 6 months later, was still okay, no big change, maybe a couple degrees. They said come back in a year. Hit my growth spurt that year, came back, the curve doubled, was probably 30 some degrees, I remember, went from like 16 to 32, and they put me in a back brace. I went through a couple of those in high school, having outgrown one, and then the second one, and then after the second one, my curve was measured at probably 40 degrees, and they said, well, that's it, the back brace didn't work, and you're a big boy now, and that's it. And I was about 17 at the time, and for the most part left untreated. I think I saw an orthopedist once, maybe when I was 19 or in my early 20s. He recommended surgery. I said no thank you. You know, I wasn't in pain or uncomfortable or anything. Nothing was bothering me at the time. So, and you know, the orthopedic surgeon that treated me as a child told me I was borderline. He said a lot of doctors would want to do the surgery. I don't recommend it. I wouldn't do it on you. He was retiring, and I kind of took his word for it. Happy I never did the surgery. But fast forward to my mid-30s, I started feeling uncomfortable, especially when sitting. My neck started to give me a lot of problems. I sing professionally, and my jaw is always very, very, very tight. I have TMJ, it locks and it pops. So that's definitely a challenge when I have to sing, because I have to be relaxed and I'm always stiff. So posture is an issue. So I'm researching for different types of therapies for scoliosis, because all the orthopedic surgeons want to do is cut me open. And I find chiropractors that specialize in scoliosis. And I max out my credit card, and I take 2 trips to Connecticut.
They don't really
specialize in it. No, they specialize in making a lot of money,
Yeah.
but not in treating me. So I took a couple trips to Connecticut. I thought it was working, you know, probably more in my head than anything else. I couldn't keep up with with that schedule of treatment and traction and all that stuff. And so I kind of let that go until a couple years later, I saw that there was a doctor who did the same thing now in North Miami Beach. So I started seeing him. I went out and purchased the traction equipment. And fast forward about a year or so, I found myself standing like this. My shoulders were 45 degrees to my feet. I really started having a lot of pain sitting on the floor with the kids, and that became very problematic. Fast forward, I guess, to about 4 years ago now. I was just before I was turning 40. My father met a physician, an Israeli guy, who practices in Pisa. He is a distant cousin of my dad's best friend here in Florida, and he's a rehab, physical rehab type physician. I spent a month there. It was a long time, but that treatment method proved to work. He was able to derotate my back, but again, it was a month. It was about 6 to 8 hours of treatment a day, and it was all electronic stimulation. So it worked. Yeah, I still feel good from what he did. There's still plenty of issues that I have to deal with, and traveling to Italy on a regular basis is just not a practical thing for me. So
you still have a
the hump I have, he didn't work on the S curve, because he worked on the problem with me at the time was that the vertebrae or my spine rotated.
well, that's why
So
you have a hump.
he pulled it, well,
That's the hump.
perhaps, but I was standing like this. So, and he managed to pull my shoulders back.
Okay.
So But I have a lot of problems with my neck, my jaw, my hip is starting to hurt,
Now,
and
does your arm bother you?
my arm. In recent months, yes, to raise my arms, yeah, my shoulders.
To raise the
Just
arms.
To
What
raise
if
my
you don't
arms.
raise them?
If I don't raise them and I sit like this, I guess they don't hurt me.
Arms okay. Which side is your headache on?
Which side is my headache on?
Your left?
The headache is just like a, it's not a bad headache, it's not like a migraine
Is
headache,
it
but I
left
get like a,
more than right?
no, it's just like a all-around headache, like a vice kind of. I feel like it's that type of, maybe it's a tension headache.
No such thing.
Stress headache, I don't know.
No such thing. No stress headaches are possible. These headaches are all from structure, ligaments. And you can put your finger on it if you know how to do it, and they are all treatable. But tension headache does not exist. Migraine is from a joint. And what else did you say? Tension?
The TMJ I have, the jaw
The
problem.
TMJ is a different story. Okay. Which side of your neck hurts the most?
The really down the back, the right in the upper back is very, very painful, and turning my head from side to side is sometimes extremely painful.
Yeah.
In the car, if I have to turn around, my range of motion is not.
Anything wake you up at night?
It's funny. I used to not wake up at all at night, and a couple weeks ago, I was finally put on a CPAP machine because I went for a sleep test. I'm tired all the time. I'm constantly debilitatingly tired the last 6 months. I have about 2-3 good hours of wake time a day, and then I'm sometimes taking a nap in the car in a parking lot because I'm just that tired. My friends, and for years my wife told me it sounds like I'm choking in my sleep. So I finally did go for the sleep test. It took 45 minutes for them to put the machine on me, and at 8:30 I was passed out. They said, you need a CPAP machine.
I never believed that.
Yeah, so I never really woke up at night before then. I just wasn't sleeping well. However, now that I'm on the CPAP machine, I'm waking up all the time because it's extremely uncomfortable. And I feel like I'm being strangled and choked at night.
Precisely right. That's right.
So,
All right. Either leg hurt you.
my legs now.
Lower back.
My hip and my lower back. Yeah. If I'm in a position, I never played hockey or basketball, but when I tried to play basketball as a kid, I couldn't do it because of the dribbling. If I'm bent over, I can't stand. It takes me a very long time to straighten up. Brushing teeth in the morning, hunched over the sink, it's like it's painful to get back up.
Are you a religious person?
I'm a cantor for a living, so I'm not non-religious. I'm certainly not a non-believer. I'm not one of these people.
We're going to do we're going to do a
I
miracle on
believe in
you.
miracles. I definitely believe in prayer and miracles.
We're going to do one on you.
So,
Yeah.
no, I do, yeah.
Okay. Let's start your exam now. Put your hands right here. And open your jaw. Does that hurt? Or does this either one hurt?
When you push, no.
You don't have TMJ.
That's what it's been described as.
You could eat my favorite meal, which is a sausage sandwich.
I can eat, I can chew well. I can't open my mouth is the
You are
problem.
opening it.
It hurts when I open it.
Where?
The action of
Where does it
stretching
hurt?
here,
Show me.
here, up in here.
Which side?
Tight and it locks.
Which side?
It usually locks and pops here.
See, I don't feel that.
I've learned to manipulate it because I
Go
sink.
ahead, open. They're both moving about the same. All right, chin down. Which side hurts you?
Here.
Oh, it's dorsal. It's not even in your neck. Chin all the way up, way back. And that's good. All right. Chin over here. Oh, where does that bother you? On the right?
It bothers me more when I turn to the left.
Okay, but you're on the right now. What hurts?
It doesn't hurt at the moment.
Well, it should be hurting you right here. This way. Okay, where does that hurt?
It hurts in here.
down below. I think most of your trouble is the dorsal.
Yeah, turning to the left is much harder for me than turning to the right.
But it doesn't bother you, though. Doesn't bother you in the
Not at the
neck.
moment, no.
It has to be.
Well, when I'm sitting for a long period
No,
of
it has
time
to
is
be.
when it really starts to
It
hurt.
has to be right now.
Now it hurts. When you move it,
Right
it
there?
hurts. When I move it hurts.
Right
yeah.
there? Is
Yes.
that the one?
Yeah.
I know about this one. That's 4, 5, 5, 6. Oh. You go up pretty good, though. Chin up. Way back, way back. Where does that bother you?
In the back.
The dorsal, yeah. Okay. All right. Stand right here. Turn around. Yeah, let's see that. That's good. Just stand right there. Go ahead and bend forward a little bit. You got mostly rotation. This is flat and this is up, which means that vertebra is actually turned this way. Now, we have to look at it under the fluoroscope. We'll find out where the scar tissue is holding it. And then we'll try to relieve it. All right, you're looking good. No problem. Have a seat and I'm going to show you this. This is stuff you've never seen, have you?
Not like this.
No.
I mean, I've seen X-ray.
You go to the gym?
I used to. I stopped
Why?
because it didn't feel right anymore. Because
I agree.
Pee-wee was getting too
Pee Wee was getting, every time I would do something, this side felt very, like getting aggravated, and I stopped. But if I could get back to the gym, I'd be a very happy person.
All right,
At least a little bit.
this is the first one. This is what we were after. You see the bones rotated this way. See this is long and short? And we want to derotate those. So then it's after the shot. And I don't see that much change, but that's okay. We're dealing with a long-standing
course.
scar tissue.
Yeah, sure. Yeah.
So when you're turned like that, I can't get to it. See, here's the problem. When you're turned, you're like this. So the scar tissue's under here. How do I get to it? I can't get under there. So we do as little as we can to get it to seep down there and do the job. And then over a period of days, it will turn. And then we go for a new target. See?
Right.
Bring that target up where we can get it. Yeah.
It's similar to what the guy did in Italy, just very different and much less time consuming.
Well, he doesn't have the answer, which is scar tissue.
Right.
He's trying to do electrical stimulation, which doesn't work. All right.